Hi, everyone, and welcome to the Global P.A.D. Impact Awards, where we honor exceptional contributions to peripheral artery disease care. Today, we present the Global Vascular Surgeon of the Year Award, celebrating excellence in the treatment of peripheral artery disease. This prestigious award recognizes a surgeon who has made a remarkable life and limb-saving impact on patients across the globe. And this year's awardee has distinguished herself through her innovative approaches to treating P.A.D., significantly reducing amputation rates. Her dedication to learning and pioneering new techniques for limb salvage has enhanced the quality of life for countless patients around the world. Her commitment to empathy and patient-centered communication also ensures that every patient feels heard and valued. Plus, her leadership in interdisciplinary collaboration has fostered a holistic approach to patient management, benefiting both patients and the medical community. But that's not all. This doctor also has a profound impact on patients across the globe through her groundbreaking research, participation in clinical trials, and through educational opportunities that reach physicians and clinicians in every single country, inspiring the next generation of surgeons to continue to move the needle forward in P.A.D. care. Overall, her contributions have left an indelible mark on the field. So I am incredibly honored to introduce all of you to the Global Vascular Surgeon of the Year for 2024, Dr. Marta Lobato from Spain. Congratulations, Dr. Lobato. We appreciate all you do to save life and limb. So well deserved.
Thank you so much, Kim, for your kindness, and thank you for this amazing honor. I'm truly grateful to be recognized as the Global Vascular Surgeon of the Year. This award reflects not just my work, but the hard work of my entire team and the support of my patients. I'd like to especially thank my colleague, Awardees, for being so inspiring. His support, his guidance have been invaluable on my journey. And thank you again for this wonderful recognition. Thank you very much.
It is well deserved. I'm curious, very few women in this space, but we are thankfully seeing more and more. And every single one of the female vascular surgeons are true powerhouses, such as yourself. What sparked your interest in peripheral artery disease care, and more specifically, advanced limb salvage?
Well, Kim, you won't believe me, but the truth is that it wasn't a personal choice, but rather imposed by the head of my department. As a vascular surgeon, I was always focused on the aorta. And what I never imagined is that something I wouldn't have chosen could inspire such passion in me. And maybe this is because when you deeply understand something, it is easy to fall in love with it. And I can say that in my case, from dedication, passion emerged. And moreover, working side by side with Awardees has been amazing. His passion, as well as his firm belief in what he does, have been truly inspiring. His dedication motivates everyone around to strive for excellence in every procedure and with every patient. So I feel really blessed to work with him, and I feel blessed to work treating P.A.D. because I'm really passionate about it right now.
But so many doctors that treat P.A.D. do not perform advanced limb salvage. They don't use those advanced tools. They don't use the advanced techniques. Why is it you became involved on the advanced side? Was it because who you were paired with Dr. Awardees, or was it also that you fell into that as well?
Well, of course. I really feel fortunate about this because working in a CLTI, I work in a CLTI dedicated unit. It's the only one CL BTK BTA unit in Spain. And this allows me
Oh,
to
wow.
focus specifically on advanced techniques and tools. Because as you know, vascular surgery is a very broad specialty that includes many endovascular and open procedures. So when you specialize in such a particular area of pathology as is BTK-BTA, it becomes easier to stay updated on the new advancement in the field and also to develop new techniques to treat your patients. So I think it's a global situation.
Patients are so important. How do you use patient-reported outcomes in your practice, and what improvements have you seen in your patients' quality of life?
Well, I incorporate prompts into my practice to gain insights to my patient experience because I think this is really important. And outcomes from their perspective, you need to know what your patient thinks. And by regularly assessing their symptoms, functional status, and overall satisfaction, I can tailor treatments to better meet what they need. Many patients have reported significant improvements in their mobility and quality of life, which reinforces the importance of patient-centered care. So I think this is really, really important.
Can you share an example of how you have reduced the need for repeated interventions in PAD treatment? A lot of doctors won't even attempt advanced limb salvage techniques because it leads to this revolving door of treatment. But you've managed to reduce repeated interventions. How so?
The fact of the matter is that to reduce intervention, a multidisciplinary approach to the pathology is important. The most crucial aspect is proper control of risk factor, of course, best medical treatment, exercise programs, and all these things, all this stuff. Additionally, the role of the podiatrist is crucial in preventing reulcerations. And this holistic approach helps to reduce the need for further interventions and allows the patient to maintain a better quality of life.
Yeah. So how do you ensure that your approach to patient care is empathetic and centered around the patient's needs and their feelings, especially?
Well, you can never be sure, but I try to focus on open communication, active listening in my practice. Because if you take the time to understand patients' concerns, fears, and goals, maybe you can create a more empathetic environment. I also encourage patients to participate in their care decisions. It's also important to take time to listen to patients' family and thus better understand their psychological context. This is very important to know not only the patient, but everything and everyone who is around the patient.
That's a really good point, but not just the patient, but listen to the patient's family that is observing everything that's going on and hearing what you may not be hearing outside of clinic. I love that. Really important. Um, what is an interdisciplinary approach to care mean to you, and what role does that play in your work? How does that benefit patients as well?
Well, I think we all know that interdisciplinary collaboration is crucial in managing PAD effectively. We need to work closely with primary care physicians, wound care nurse, home care assistant, infectious disease specialists, endocrinologists, podiatrists. We can create comprehensive care plans that address all aspects of a patient's health because this collaborative approach ensures that the patient receives well-rounded care, leading to better outcomes and improved quality of life. And we must raise awareness that this approach is essential for patient to do well.
And for the patient to actually do well, they also have to be a really good partner in their care. What is your approach to helping patients comply with critical lifestyle modifications such as smoking cessation, diet, and especially exercise?
Well, Kim, in our hospital, we are fortunate to have a specific clinic for risk factor management led by an internist.
Oh, wow.
Their patients are made aware of the importance of lifestyle modifications through education on their impact on P.A.D and overall health. The team is composed on a doctor, an internist, a nurse, and a psychologist, and they work with patients to set realistic goals and offer resources such as support groups and counseling to help them to give up smoking, to facilitate behavior change. Regular follow-ups help keep patients accountable and motivated with these changes. So I think this is really important, and we are really fortunate to have this team who is really involved in this situation.
And so what type of walking regimen do you promote with your patients to improve? It's such a buzzword, but it's so important. We see walking is the most important medicine. So what sort of regimen do you encourage with your patients to improve their circulation naturally?
Well, you really know that this is crucial for the patients, that we really don't have a supervised exercise programs. So I usually suggest to patients that they walk daily, starting with short sessions, adapting the pace of their walking, and gradually increasing the duration until they can walk for an hour to an hour and a half each day. I encourage them to keep a record of this activity, which we then share during the follow-up visits. Because I think if they have to write down what they watch each day, they feel more obligated to do it. Mm-hmm. And it's like a kind of reminder of what they need to do. So I ask the patient, okay, show me. Have you written how much have you walked? So I want to see it. And so I think this is a good way to do it, because we really don't have supervised exercise programs would be the best for the patient, but unfortunately we can't do it.
And I have found that patients don't lie about how much they walk. They actually will tell you. They will also tell you, you can read it right across their face if they've stopped smoking as well.
Yeah.
It's amazing how honest people really truly are when it comes to talking to the doctor. They really are honest, even to their detriment. I want to talk about some of your publications that you've put out there. We said that you not only have an impact on improving patient care in Spain, but you also have an impact globally. So I want you to tell us about some of your most important publications and how they have contributed to the field of P.A.D.
Well, our team, led by Dr. Isa, described the venous arterialization simplified technique for deep venous arterialization in no-option patients. As you know, this technique has become one of the most popular, as it allows for off-the-shelf DVA, and is being used worldwide due to the low availability of dedicated devices. Mm-hmm. Our team has also published numerous bailout techniques for complex recanalization. And this year, we have published tips and tricks for simple and complex VTA puncture, which is among the most read articles in Journal of Endovascular Therapy. Additionally, we have recently published, together with Dr. Patrone, the PA.D technique, which is also useful as a bailout in extreme revascularization of the below the ankle segment. And currently, we have a new project in collaboration as well with Dr. Patrone, which we hope will be published soon. So maybe we're going to see it soon.
And we are very familiar with Dr. Lorenzo Patrone. He actually was, I think, our 2021 Global Vascular Doctor of the Year. 2020 or 2021, can't remember, but he's also been our global patient champion. And he's moved from London to Italy. So definitely good company there. You mentioned publications. I imagine they involve trials, right, along with it. What trials are you involved in right now, or you plan to become involved in?
Well, we are not involved in any trials right now, but I'd like to highlight a clinical trial in which we participated in collaboration with our home hospitalization department regarding an antioxidant dressing to evaluate the clinical efficacy of a new antioxidant therapy for the treatment of complex neuroischemic diabetic foot ulcers. We loved this trial because the dressing feature was an antioxidant technology developed right next our hospital in very, very near to our hospital. And the results of this trial were amazing, very good clinical outcomes in large, hard to heal neuroischemic diabetic foot ulcers with significant wound area reduction and granulation tissue formation without the need of using back therapy. So it was amazing, the results of this research, 2 years. And we are very happy. And now we are using this dressing in our patients. So
I love that. Hopefully that will spread like diaspora across the globe, and more people will learn from that. I think that's amazing. What about one of the ways in which doctors learn, about these things is through speaking opportunities. And I know that you are a speaker at multiple conferences. I'm curious what some of your most memorable speaking opportunities have been and how they have influenced your work and that of others in PAD care.
Well, you always remember your first time, and of course, my first presentation at the National Congress, National Vascular Surgery Congress in Spain, when I was a fellow, was significant. However, I would really highlight my first talk at the Limb Congress. You know, the Limb Congress, which is the biggest congress in Germany.
In the middle of nowhere. And they deliberately
yes,
make it in the middle of nowhere in Leipzig, Germany. We're the only people on the flight from Frankfurt to Leipzig are the doctors and clinicians attending the conference.
Yes, that's true.
That's the one.
And I presented, and the first time I presented a case in Find Your Algorithm Congress. I remember that first time was 3 years ago, and it was during the first session. I was nervous, but it turned out to be an incredible, enriching experience thanks to the atmosphere of debate. You know, FYA is one of my favorite congress because you can discuss everything you want, and it's a really good opportunity for learning. So I will always remember that time, and I'm really grateful to Lorenzo Patrone for this opportunity. I really, really like this Congress.
I love that Congress. It's the first Congress I've ever been to where they design every one of you puts a lot of work into your presentations, and you design them so that they engage the audience. For those who've never been, especially the patients who are watching, every single one of the audience members gets a set of flags, and each flag represents where they might fall in terms of a multiple choice question about a particular case and what they would do in the same situation. So the doctor starts presenting the case saying, here's a diabetic patient, high cholesterol, and they have a wound that won't heal. And we pumped in the contrast fluid into their vessels, and we saw a blockage in the thigh, in the SFA, superficial femoral artery. And they go to the audience and they say, what would you do first? And they ask the audience, they say, would you go ahead and send in intravascular ultrasound or IVUS first to check the sizing of the vessel and the morphology of the plaque, the type of plaque? Would you send in a catheter right away with a roto-rooting device? Or would you go ahead and go straight to a balloon and inflate the balloon to push the plaque aside? And so the audience ends up raising the flag for where they fall. And you'd be surprised that you usually get several of each flag actually raising them up. And they go out to the audience and find out what each person would do and why, which creates a really amazing discussion. And then they go back to the presenter and they say, okay, what did you end up doing? And what's interesting to me is not every case ended up to be a success. And so you don't know where that presenter is going with that case. And if you raised your flag and you would have done something different, you might have been right, that might have been the direction to go. So that's what I love about that particular conference. And Dr. Petrone created an amazing
For me, it's
design.
a really game changer in terms of education due to the discussion, the open discussion, and it's really enriching. So I really love this Congress.
And it really closes one of the major communication gaps that I think is resulting in suboptimal care for PAD, or should I say inconsistent care in so many different areas. And I think that conference actually sparking a conversation opens up that communication that leads to more people getting on the same page and finding resolves in some of the major issues that are facing PAD patients across the globe. But what gaps do you see in PAD care today, and how do you hope to address them in your practice?
One significant gap in the care of PAD is the lack of awareness and education among both patients and health professionals. Many people are unaware of the risk factors, symptoms associated with peripheral artery disease, which can lead to delayed diagnosis and treatment.
Yep.
Additionally, medical professionals may not always prioritize PAD screening, especially in population at higher risk. And furthermore, I hope to advocate for the integration of PAD screening into routine cardiovascular assessment, particularly for a high-risk population. Because by raising awareness and promoting proactive care, I aim to improve early detection and management of PAD to improve patient outcomes.
Yeah, that's a huge one. I agree with you 100%. We don't understand why some doctors are so resistant to performing a simple ABI test, the ankle brachial index test, at all on patients with high risk factors. It just doesn't make sense to me. So huge one. I love that. And I only have a few more questions, left, and then we can open it up to some of our in-studio audience. But I'm really curious, as one of the few female powerhouse vascular surgeons, how do you feel your perspective and experiences have shaped your approach to PAD care and have influenced care?
Well, I really don't know, but I would say that being a female vascular surgeon has given me a unique perspective on patient care. I understand the importance of empathy and communication, which I try to prioritize in my practice. I think you need to share pain and fears with your patients, and this is essential for emotional well-being. So I strive to create an inclusive environment where patients feel heard, valued, because I really think this will end up giving the patient better care and, of course, better outcomes.
I agree. So, what advice would you give to young women who aspire to enter the field of vascular surgery, especially not just general PAD care, but we're talking advanced PAD care, becoming a CLI fighter like yourself? And how do you hope to inspire them?
Well, I think that if you want to be dedicated to PAD, you need to be passionate. My advice would be to follow your passion without giving up, to work hard, to seek mentorship from experienced professionals in this field, because it is essential to build a supportive network and advocate for yourself. And probably one of the most important things is remember that there is no reason why you can't succeed. And I hope to inspire them by showing that it's possible and just say to everyone that they can. I think that's the thing.
And I think show up as you do. Find every single way to show up and be out there. And I love seeing you on podium at every single major conference that I go to. I mean, you travel the world to spread the message and share the tools and techniques that you use to improve patient outcomes. And I think that's huge. You have conviction also in your techniques and what you do with proven patient outcomes. And I think that that's huge. And that's something that I think that we need more women to do as well, is to stand up, have conviction in courage to get out there and start to share what they're doing to improve limb saving and improve life saving for patients across the globe. So thank you so much, Dr. Lobato, for all you do. I have a final
Thank
three
you for.
questions. I have a
You
final
are really
three
kind,
questions
Kim,
for
with
you.
me.
I always have more questions and more questions and more questions. I could keep you on here forever. But we have three special series that we do. The first one is called Journey to Diagnosis. And it's all about the story behind those patients who are not getting diagnosed sooner or who are getting misdiagnosed. So, share a case that had you just scratching your head about how in the world this patient was not diagnosed sooner and what you wished would have happened.
Well, it would be great, just only a case, but I believe that, yes, I believe that anyone involved in PAD has encountered multiple cases of patients with erratic diagnosis before finally arriving at the PAD diagnosis. As we have discussed before, this is often due to a lack of knowledge about this pathology, and which is undiagnosed, and this frequently leads to patients being diagnosed late, or unfortunately only when they already present CLTI.
Right.
And this is a tragedy because the patient goes from being undiagnosed, the patient doesn't know at all about this pathology, and one day is being at risk of losing the limb. So this is really a really dramatic situation. And I would say that every doctor who treats PAD has been in this situation more than one time, unfortunately. So we need to fight against this situation. And that's why what you say is really important. ABI, vascular care, particularly in patients at high risk, and we know who they are. We know the high risk population, so we need to aware them and to and all the population to be conscious about this pathology.
I agree. And 6 minutes that mattered in your life, in your career. This is a moment that truly was a defining moment for you that led to some sort of change in direction, a spark that led you somewhere in your career. It could have been a conversation that you may have had with someone, inspirational words, a clip in a movie or a show, or something you saw that was eye-opening. What was that moment that mattered for you?
Well, it was in a film. It was during a challenging case when I feel desperate, and my colleague was by my side, my colleague Awardees, and he told me, you need to have the courage to fail, because every failure is an opportunity to learn and grow. And this advice was really, really important. Shift my perspective on setbacks, encouraging me to take risks, to live my fears, and to view mistakes as a valuable lesson rather than definitive failures. Because we are always concerned about failures. Failures are very hard when treating this kind of patients, and when you are thinking that you can lose a limb, you can lose a life, because these patients, sometimes when they lose their limbs, they have lost the opportunity for having a longer life. So I learned that true growth comes from stepping out of your comfort zones and facing challenges that you need to do it. And this was a really important moment for me. And I can never thank him enough, because this was crucial in my professional life.
And it's amazing for patients that are watching is that she even considers amputation failure. And most of the patients that come to her and come to her partner, Dr. Isa, they are already on deck for amputation. And so failure is really what would happen if they didn't treat, but also it still could happen if you treat. And so she's, willing to go in there and do everything in her power to at least try to save that leg. And that's remarkable. And so, speaking of lessons learned, can you share a case with a big lesson for you and others? Go ahead and describe the patient, the frustration you had with the case, and the lesson that you and others could learn from it, or maybe you learned and others can now learn from it. It could be a success, it could be a failure, either one.
Well, it is about a diabetic patient in his early 70s with bilateral ischemia and small artery disease, as you know, failure in the distribution system. After several revascularization attempts with early recoil, we really had no option. So we decided to perform bilateral venous arterialization. This is a really dramatic situation because it's the last option. And although things initially went well with the patients and the ulcers were healed, the technique in one of the legs became occluded. And after several interventions, thrombectomies, the patient ended up suffering an amputation. So we had a failure here. And in the other limb, he had a new ulcer. So we were fighting with this ulcer with wound care. And the greatest lesson came from the patient when he told us that his father and brother had suffered bilateral amputation.
Oh, wow.
And that we should not give up with him, that he wanted us to fight for his leg, but not for him, but because perhaps by treating him, we could learn more about P.A.D., how to prevent his son and granddaughter from losing their limbs. So in the middle of this suffering, the patient always found the strength to encourage us to keep going. And so this was really incredible situation.
Wow, what a powerful situation, and what
Yeah.
a good human he was too. That's amazing. What a powerful story. Thank you for
Yeah.
sharing that. I want to open it up. We might have a couple of questions from our in-studio audience here. I think Douglas has written his over there in the chat, but Douglas, go ahead and unmute and ask Dr. Lobato, our Global Vascular Surgeon of the Year, your question.
Congratulations. You absolutely deserve it. We love listening to you and that passion that you do have. A kind of question would be two things. Do you see a big difference where you are in like the States here in the learning curve of treating P.A.D. and how the doctors keep up with technologies? Is there that big a difference? And kind of a little bit of a personal, being a female, have you run into that getting where you are today? Have you run into that where most doctors are men and there's that little thing going on? Have you experienced any of that becoming the doctor that you are today?
So the first question is basically you're wondering about the differences in adoption of advanced limb salvage techniques in Spain versus in the U.S. Do you find that more doctors in Spain are more interested in learning the advanced techniques than maybe here in the U.S.? Is that your question?
Yes.
Okay.
Well, thank you, Douglas, for your questions. I don't think so. I think in the US, you have very well developed the P.A.D. care. Maybe it's not a homogeneous situation, but in Spain, neither. I really don't think that in Spain, vascular surgeons are the ones who cares about P.A.D. No cardiologists or interventional radiologists. Most of patients are treated by vascular surgeons, and sometimes the problem is that vascular surgeons are more in Spain, more focused on aortic disease than in peripheral artery disease. And there are not that much dedicated units to treat these patients. So I think, I really don't know. I think in the US you have a very developed system, a healthcare system, and you are a rich country. We are not that much. That's why sometimes we develop bailout techniques, off-the-shelf techniques to try to treat our patients, like the PAS technique, for example, because we don't have the opportunity to have a lymph flow system, for example, in Spain on other devices. So we need to develop bailout techniques to try to treat our patients.
Yeah, it's true. But you guys do amazing things, very creative things to get some amazing outcomes
Well,
there.
the necessity is the mother of invention. When you don't have things, you try to look for ingenious things
Yes.
to do it.
Yes. And I think his second question was about being, a female vascular surgeon and what it is like for you being surrounded by a sea of male vascular surgeons, and if that affects you in any way at all.
Well, I would say that no. I have always been supported by my team. We are more women, not dedicated to P.A.D. And I really haven't felt that much this difference. I would say that no.
So, I mean, obviously, you're Global Vascular Surgeon of the Year, and it's because you're a super exceptional vascular surgeon that is having such a profound impact on patient outcomes, you know, right there in Spain, but also because, again, your speaking opportunities, the clinical trials you participated in, the publication, you're standing up the podium at conferences across the world, and you're influencing other doctors. You're influencing the next generation of limb salvage specialists. And for that, we thank you so much, Dr. Lobato, from the bottom of my heart. It's so well deserved. You are truly the 2024 Global Vascular Surgeon of the Year, and we appreciate all you do to improve patient outcomes across the globe.
Thank you so much, Kim. I really appreciate this award, and I want to congratulate you for your work, what you do every single day for P.A.D. patients. Congratulations.
Thank you. And I couldn't do it without amazing CLI fighters like yourself.
Thank you so much.